chin to the chest, okay? That just eliminates them, like, doing any extra, like, gobbledygook, okay? Then I say, just go ahead and I want you to keep your knees straight, just bend forward as far as comfortable towards your toes, just reach for the floor, okay? And I am looking, I usually have their shirt up, and I am watching how their spine moves, okay? I'm just kind of watching, is there any asymmetry? I look here, are they bending evenly? You can see if there's a rib hub on one side, if they have a scoliosis, okay? These are just some things I'm looking for, okay? So I'm kind of seeing, how much of the motion is. Do they do this? Do they go kind of like, oh my God, they've got back pain? Or do they bend symmetrically? Is there a nice C shape? You guys don't allowed to stay down. It's killing me. Sorry. Yeah. So do they have a nice C-shaped curve? Or are they kind of like hinged? Do they not want to go? Is it hamstring flexibility that's limiting them? Like, could they go farther if their hamstrings aren't so tight? So you guys can assess a lot. Do they deviate to one side or the other? Okay? Are they right or they left? Okay? So those are some great things.
Listen more. Want spinal flexion?
Spinal flexion. Yeah. So this is flexion. Okay? Now, come on back up. I mean, if you guys want to switch, you can, but otherwise I'm going to show extension. Okay, so how do I assess extension? I block their knees here, okay? So I block their knees because I don't want them doing like, the gymnastics thing. So I just stand behind them and I say, go ahead and put your hands in the middle of your back. So I have them just kind of protect their back like this. Some people don't believe in doing that. I just have people, I think they kind of feel a little bit more symmetrical, and I'm blocking them anyways, so they're not going to, go too far. So you'll find people that say, don't block this, just let them go. I find that they tend to like more hyperextend and kind of like do, stick their stomach out if they don't block here. And some people feel like they don't like to bend backwards if they got back pain, so I feel that they're just feeling like they're protecting themselves a little bit more. So I block their knees here, and I just kind of help guide them. I say, go ahead and put your hands in the middle of your back, palms facing you. Facing you. Awesome. And I say, just go ahead and bend backwards. Yep, and they're just going to bend backwards, and I'm just going to block their knees, because they can only go so far, okay? Just make sure that you guys have a nice wide base of support when you do this, because if they should start to go, you don't want to be like both of you guys falling backwards.
Where are you putting your hands?
Where am I putting? I'm having them put their hands like this.
No, I meant, okay, but where are you putting your hand?
Where am I putting my hand? I'm here,
Okay.
and I'm blocking here, and I've got a nice wide base of support. So if they suddenly start to like get, unstable coming backward, I'm not gonna like fall over and injure myself, and my patient's not gonna fall on me.
The pelvis supposed to be in one.
Yeah, so I mean, basically, they're able, this is how much lumbar
Okay.
spine, extension do we have? Not a lot, right?
No.
So if I am doing like that, it's wrong.
Yeah, it's right, because I'm blocking your knees. So that's why I never have patients just do it on their own, because what they'll do, they'll bring their knees forward and shift weight,
What about
okay?
throwing pelvis forward?
Yeah, so you can't throw pelvis forward if you're blocked here and blocking your knees too much, okay?
Wait, what? Okay.
You're going to block their knees. You're going to have them put their hand here. So I am not letting them get excessive motion, okay? They're not going to be able to shift their weight forward if I've got their knees blocked. Understand? I mean, I don't have them stand together like this. I have them stand in neutral. Yes, you don't want them standing like this, but I think it's kind of like this is an unstable base of support. So you're going to have people that are going to tip over if they're like this. So I usually tend not to have them stand like this because most of us don't stand like this. I have them stand just in a neutral, symmetrical. I don't know if it does anything different, but I have them stand just in a symmetrical base, okay? Okay, when I do side bending, when I do lateral flexion, I make sure that they're laterally flexing, okay? A lot of times when they lateral flex, they'll kind of go like this, okay? So I say I want you to run your hand down the side of your leg. They're laterally flexing. I watch them and I kind of guide them, because what will patients do? They'll try and get extra. They'll kind of go, oh yeah, let's get cool, Or I see this a lot. I see like,
Oh yeah, bend.
Okay, that's not pelvic motion, okay? This is a great one. When Tim was doing like PSIS assessment, quick story, quick little side. So I was early on, my first, second year of doing this or something, and this little old lady, this 84-year-old lady that came in, and I'm like, yeah, I'm gonna assess your, hip height here and stuff, and I'm back there, and I'm like, do you mind if I just roll your pants down a little bit? And she's like, oh, no problem. And she drops her drawers, I'm in my face, like old lady bone, all of a sudden, and I'm like, oh, it's not really necessary, yeah. So I just had to put it out there. Because every time somebody's like this, I always think of her, just because she was just like, no problem, and I'm like, oh, really, we don't really need that, Okay, so don't tell people, yeah, no, it's not Poland. Okay, so anyway, so once again, lateral flexion. flexion, make sure that they're just doing lateral flexion, okay? They're not getting rotation. Because we'll find out that our spine, Tim told us the spine, and when we do side bending and rotation, they occur in the same direction, that type of stuff, okay? So make sure that they're very symmetrical. When I do rotation, I have them cross their arms like they're a genie, okay? And I just kind of guide them. I'm watching here, especially with lumbar side flexion, you can see where they hinge. Like, if you guys don't mind, roll your patient's shirt up a little bit. Watch where they hinge. See if they hinge at the lumbar spine, if they've got a symmetrical C-curve, or if they hinge, like, at the thoracic lumbar junction. So you'll see. Roll up shirts, check it out. If people don't mind. Do you mind if I turn you on here? Okay, turn on. So what I'm looking at here, guys, and what I'll do is, on my patients, like guys, usually I'll have them take their shirt off. Women, if they've got a bra on or a sports bra, sometimes I'll just tuck that in there. Okay? So you stand evenly, and just take this hand and put it down by your side. And you're just gonna bend down to the side for me, to the right side. There you go. So what I'm looking at is I'm looking at this symmetrical curve here. This should be a nice C curve. Okay? If he hinges, you can see he kind of hinges right here. Lumbar spine. Thoracic spine moves, lumbar spine doesn't move too much. So you guys can see maybe where there's a restriction. Does that make sense? Mm-hmm. So you can see on your patients, it should be pretty much a C curve. If they've got a spot, sometimes that's their painful spot. Okay? So you can kind of assess that a little bit and see where they hinge from. Sometimes it's different. Go ahead and lean to the left for me.
Should I lift up my other arm?
No, you can just let this arm by your side. Yep, and you put this arm by your side and just reach down the side. So see, that one, it's a little tiny bit better. It's got a little bit more of a curve. Okay? Can you guys appreciate that on people? Does that make sense? What I do for rotation, so this is rotation, yep, go ahead. And you can do the genie arms. I do genie arms. And I kind of guide them a little bit. I'm like, go ahead and just turn to the right for me. And I just kind of guide them around. So I see how much they have, then I can just kind of see how much, is that painful, is that okay?
We are not
okay?
stabilize the
and
pelvic.
you look to see, is one side versus the other side, are they symmetrical or are they not? I mean, you can measure goniometry-wise, people can measure. I don't know, I used to do that, and I thought I needed all these, great, exact measurements. I kind of see where they're limited. Now I watch a lot more. I kind of see where I see limitations.
So lumbar spine should go with